Hello students, we will discuss a very simple but interesting case. I will show you. It's a spotter. Look at that, you can give a diagnosis what this entity is. So I put entity. Look at this here. Look at this. There is like this, projected like this. So very typical of sebaceous horn. One of the complication of sebaceous cyst is horn. Other than that, Cox specular tumor, infection, abscess formation, all those things. So because from the summit of the sebaceous cyst, sebum exudes out, very foul smelling it is, nauseating smell it has got, and that exudes and forms a, instead of getting fallen down, it forms a, they get dried up and project like this, like a horn. So very typical sebaceous horn. You can see these different sebaceous horn features are there in my book. And what are the features? Sebaceous cyst is a retention cyst. What type of cyst it is? A common MCQ also. It's a retention cyst. It often causes sebaceous horn. Slowly discharging sebum get hardened for horn. It is treated by surgical excision, like under local. That is the same thing like anything. Make an elliptical incision and remove it. If this is a horn, make an elliptical incision, excise it under local anesthesia, field block, then suture it like this. So excision under local anesthesia. Unlike dermoid cyst, we need excision under general anesthesia. We need a CT scan and so on. Not like that. It is simple. Excision is simple, but you should remember this sebaceous horn, whatever exactly how exactly it looks like. Common in the head, skull, face, but sometimes it occurs in different parts of the body also. Everything about sebaceous cyst, please out-examine, go through my clinical method and surgery. My manual of surgery gives a detail about different aspects of sebaceous cyst, and surgical operation shows how to excite it, and different operative procedures given in detail as a 2-volume book. My tissue approximation atlas, how to suture it, technique, skill with the video shows properly, and Diginor through JP Publishers gives in detail lectures about every topic, including specialties, then X-ray specimens and instruments, operative surgery, and clinical examination also. So students, I hope you understood very typical sign, entity, that is sebaceous horn. Thank you very much.